There's research to show that there are differences in concussion diagnoses based on race and ethnicity. So in this study, they looked at ER visits for youth athletes. There were white youth athletes who presented to the ER with a concern of head injuries. They received further testing to rule out more severe head injuries. So they received neuroimaging in the form of MRIs or CT scans in order to rule out a further, more severe type of head injury, and they were more likely to receive a diagnosis of concussion compared to Black athletes. Black athletes were less likely to receive any further testing and neuroimaging, and they were also less likely to receive a concussion diagnosis. Instead, they were more likely to receive a diagnosis of a head contusion or some other type of diagnosis that is not a concussion. Now, here's the interesting thing. A diagnosis of a concussion is subjective in nature. You have different cognitive assessments that you can look at, and you're looking at the symptoms and severity of symptoms in order for the clinician to make a judgment on whether or not there is a concussion present in an individual. You do not need an MRI or CT scan or any neuroimaging at all to diagnose a concussion. You can't diagnose a concussion through those. It's strictly to rule out something more severe. So the fact that white athletes are receiving this more advanced testing to rule out something more severe and then are receiving a concussion diagnosis compared to Black athletes who are not receiving this testing and not receiving this diagnosis means that there is a big difference in the assessment process. There's a big difference in the judgment and the assessment process of the physicians and the clinicians who are making these judgment calls on these individuals. That there is a difference in the symptom severity being perceived for white athletes compared to Black athletes. And this is not new. This is something that has been rampant within the healthcare model, within clinicians, where there's this long, outdated view of how Black individuals experience symptoms, and especially symptoms of pain, different from white individuals.